Welcome to the Beauty Scientists with Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
I really like this topic too. Just the psychological impact of rhinoplasty. I feel like obviously there's a big psychological impact with any plastic surgery, whether it's like breast augmentation for body confidence or facelifting to feel like, as youthful on the outside as you are on the inside. What do you notice about your rhinoplasty patients in terms of like how they feel emotionally after surgery?
I think we both know the most important thing is to pick patients properly as well as pick the correct treatment plan. And we've already told patients, hey, pick your rhinoplasty surgeon pretty carefully as well. The nose is in the middle of your face. Our eyes as humans are drawn into the middle of the face, really the triangle of your eyes, your mouth, and the nose, which is in between. So it's so important to have a nose, again, that's holistically in proportion to your face, that is aesthetically pleasing in terms of the size, width, profile, tip rotation, everything to your face. So the psychological component of just having a more straight nose, the ability to breathe better, as well as the tip that you've always wanted, I mean, that's very, very powerful. Patients love it. And since it's on their face, they see it all the time. I also think that the flip side is also true, where if you have a patient who may be a little OCD, if you have to a plastic surgeon or even to the average person, a minor discrepancy, but if you're really fixating on that, the problem or issue is, since you're always looking at your face in the mirror once in a while, you may fixate it on that really minor thing a little too much for your overall mental health. So it's important to patients to really, really focus on, am I being a little OCD about this, or can I live with like a 1 millimeter offset? And as long as patients understand that, hey, everybody's asymmetric, plastic surgeons can explain that in detail. I think that's really the key to having a happy overall result.
I agree. And I think, to your point exactly, this is not even your body, which is generally covered in clothing, like a normal day-to-day goings on. This is your nose right in the center of your face. One of the things I love is doing a rhinoplasty reveal at the 1 week visit when they come back and get all the sutures out and all the cast off. And patients they'll cry like happy tears all the time. It's a very powerful moment. And there's all sorts of thoughts. I hear like patients will be like, it's me, but like, it's different. I still look like myself, but I also look like a different person. And especially depending on how significant the transformation is, sometimes even that can be a little bit jarring. Like they may have gotten exactly the nose that they wanted, but it's can be just a lot to wrap your head around when you look in the mirror and you see someone that, doesn't look the same anymore. So I think I agree with you 100% on patient selection and just making sure that people they're emotionally prepared, they're mentally prepared, psychologically prepared, not just physically prepared alone from a health perspective to undergo the operation. But I think it's a wonderful surgery, and I love to perform it.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.